Hi guys, today I really wanted to talk to those of you who are interested in going into the healthcare field. And I wanted to talk a little bit more about medical specialties. So as you're preparing to think about your career and what route to take, there are some things that you really need to think about to make sure that what you go into is the right fit for you. So when I was thinking about it as a kid, there were so many different options that I knew about, but there was a lot that I didn't know about either. So you can go into various specialties, and I'm going to hit on a few of those. The first one I wanted to talk about is the medicine specialties, right? So what those are your pediatricians, your family physicians, your internal medicine doctors. We are your medicine specialists. And then there are surgical specialists. So sounds just like what you hear. They usually go into the operating room and they're doing more surgeries. So if you're really good at working with your hands and you really want to be hands-on in that way, you might want to go into that specialty. And then there are ones that help us diagnose. Those are the pathologists, the radiologists. They're looking at things and helping with diagnostics. So we find the answer to those CT scans, MRIs, biopsies that we take. They're looking under the microscope just to make sure that we tell you exactly what your diagnosis is. So when you're thinking about all of these things and what my options are, know that medicine is vast and there's so many different things that you can go into. So I really want to delve and tell you maybe why you might consider some of those. So let's start with the medicine specialties. This is the area that you're going to go into if you like that patient interaction. You're going to develop relationships with people. You're more than likely going to work in an outpatient setting, so that means a clinic rather than a hospital. You're going to be really good at diagnosing. That means figuring out the answer based on what someone is telling you and your exam. So a lot of times you're the person that they come to the clinic and see. You know them, you know about their family, you take care of them for generations. You may know their grandparents, you may know their children. So if you really like communicating, developing long-lasting relationships, and working with your mind, you're gonna go into a medicine specialty like internal medicine, family, or pediatrics. Next, let's talk about the surgical specialties. A person who goes into the surgical specialties really likes working with their hand. You need to have really good hand-eye coordination. A lot of times people good at video games are really good at going into the surgical specialties. And in these specialties, you also gotta be able to work under pressure. Usually you're doing a surgery to save a person's life, to fix a broken bone. So you're really gonna need to know that it's gonna require a lot of time. You're gonna be on call a lot of times too. And more than likely, you're working more in a hospital setting rather than a clinical setting. Lastly, I'm going to talk about the diagnostic specialties. And the reason these are called diagnostic specialties is because you really help us to diagnose the problem. This is going to be your pathologist, your radiologist, someone working in the lab, or nuclear medicine. You won't have a lot of patient interaction because you're really focused on the science. So you're going to have to pay attention to detail. Looking under slides, looking at the x-rays, looking at the MRIs, so that you can help give the people talking to the patient the right answer. You want to make sure you pick up on that small cancer. You want to make sure you pick up on that fracture that's on the x-ray. So you really have to be someone who pays attention to detail. So when you choose a specialty, there's a lot of factors to consider. Some of it is, how long will I have to do my training? Some trainings are longer than others. The other thing to consider is, what work-life balance do I want, right? Outpatient clinic setting, that might be 8 to 5. Being on call at the hospital, which means you might be on call for 24 hours or longer. So you really want to think about some of those things. Also think about, what do you enjoy? If I'm a people person, I probably want to pick a specialty where I have a lot of interaction with the patient. If I'm more introverted, maybe I want to be behind the scenes, and that's when I'm looking at the x-rays, the MRIs, or the pathology. So a lot of times, think about who you are. This is a decision that you're making about what you are going to do for the rest of your life. And above all, you want to be happy. So what do I like? What type of life do I like? And how important is it to interact with somebody else? So those are some factors to consider. You also want to get a mentor, because a lot of times we may think there's something that we like, but if we never get that hands-on experience, you don't want your first day of medical school or first day of residency really to be the first time that you experience it. So reach out to some doctors in your area, ask them if you can shadow, try to get some experience while you're young and thinking about this, so that when you go into that field, you know that you made the right decision for you. I chose to go into family medicine because I'm a people person. I love talking to people, and I love my work-life balance where I work 8 to 5 pretty much Monday through Friday. So think about the lifestyle that you want, and once you make a decision, go out and seek those experiences so that when you actually do make a choice, you're making the right one for you.